Welcome back to the Pelvic Health Summit. I'm here with Mila Mintsis. She is an acupuncturist who specializes in pelvic floor dysfunction. She has a practice in Midtown Manhattan, and we're so excited to have you here.
Thank you for having me.
So can you tell us a little bit more about your practice and approach?
So I'm a licensed acupuncturist. I specialize in the pelvic floor dysfunction, as well as I treat a lot of concussions and orthopedic conditions. And my treatment style is unique because when I come up with a treatment plan, I actually combine the modern knowledge of Western medicine together with the old wisdom of Eastern medicine. And, for example, if I'm doing a session, I might use trigger points and motor points, but then I will add on Japanese acupuncture and auricular acupuncture and scalp acupuncture, or, whatever I feel is needed for that specific situation.
That's so interesting. So can you tell us about the patient experience? What's it like when we step into your office for the first time?
So usually, I've never had a patient that loved needles. So initially when they come in, they always make sure that they tell me that they hate needles, they're nervous about it, which is normal. I always tell people, it's normal to be nervous. It's a new experience. It involves needles. Why should you not be nervous? And then once they get on the table and they realize that the needles themselves are very different from injection needles. They're actually the size of the hair, and the experience itself is very, very comfortable. So usually in their follow-up sessions, they fall asleep on the table and they feel so relaxed and they never want to leave.
So I've heard of acupuncture before, as I'm sure many of our viewers have, but can you go a little bit more into detail into what it is?
So acupuncture is actually one of the branches of Chinese medicine. And Chinese medicine it's a complete medical system that was invented about 5,000 years ago, and it actually involves, it has other branches in it as well, and which is dietary therapy, qigong, herbology, and it focuses on treating the whole individual. Where in other medical systems we look at specific parts, in Chinese medicine they really emphasize looking, at the mind and body connection, and really looking at the whole individual, and emphasizes the holistic approach. Specifically to acupuncture, the process itself involves placing small, tiny little needles into different points in the body, as well as trigger points, motor points, and so on. And by stimulating those points, you're actually stimulating the muscles or the nerves or the joints, whatever needs to be treated. And it has a local effect, which is the specific area that you're treating, and it also has an effect on the brain, which once your body is stimulated with the needles, it induces production of certain chemicals such as endorphins, and that helps with the healing process as well.
Very cool. So can you tell us a little bit about the patients you see and what pelvic pain conditions they come in with and how you're able to address those concerns?
Yeah, so interestingly enough, a lot of my patients are male patients with high stress, high anxiety, high pressure jobs. And a lot of them, most of them have pain. They have pain in sitting. They have pain in the perineum and other parts of the pelvic floor. And then my other patients are post-op, so people with abdominal surgeries, people with hernia repair after hysterectomy, also people with tailbone injuries, or a lot of different urinary problems such as incontinence.
Thank you for sharing that with me. So in terms of the patient journey, at what point are they coming to you? Are they coming to you when they're first presenting symptoms, or are they coming, you mentioned after surgery? Can you tell us a little bit more about, when patients are getting to you, and should they be coming earlier?
So a lot of the patients that come to me have actually been to other doctors, and at this point, we're lucky to have doctors that specialize, in pelvic floor therapy, which was actually not the case even a few years ago. And when they're coming in, they are already educated on their condition. And with acupuncture, the beauty of it is the fact that it complements all the other therapies. So if patients are undergoing injections or getting physical therapy, acupuncture complements it. It does not negate the effect. And then also a lot of the patients that get referred to me have pelvic floor symptoms, but they also suffer from anxiety. And anxiety, insomnia, depression, and just to help, to calm that down, just to help to treat, not their physical symptoms, but also their mental symptoms as well. Usually, out of all the other therapies that are out there, acupuncture seems to be able to, to treat the mind and the body at the same time.
That's so important. We've been talking a lot about the mind-body connection in the summit. So can you tell us an example of the way that you are integrating with the PTs that are in your practice as well?
So in my office, actually, there is a physical therapist that specializes in pelvic floor dysfunction. And a lot of times, a patient will come for physical therapy and then they will see me. It can be done on the same day or it can be done on a different day. And even patients, if they're getting injections, a lot of times they come in on the same day as well. And it complements with physical therapy. A lot of times they're able to do internal work, and then I do all the external work. So I will treat as an example, all the muscles of the pelvic floor, as well as muscles of the lower back, if there are any hip problems, which are, all of these other muscles are associated with the pelvic floor, so they always contribute symptoms to the pelvic floor. And then also, I will discuss with patient if there's any anxiety going on or if they have trouble sleeping. That's something that we will focus on as well.
Great. In addition to the help with anxiety and sleeping, what are some of the other major benefits of acupuncture, especially in terms of the pelvic floor?
Yeah, so in addition to anxiety and depression, the benefit of acupuncture is that you can actually promote relaxation of the pelvic floor muscles and the other muscles that I had mentioned, so the muscles of the lower back, the hips, the buttocks. And then also by placing a needle locally into the tissue, you're stimulating that tissue and you're locally increasing circulation to that tissue and the nerve. And because of that increase of circulation, that helps to bring the inflammation down and that improves function. I also I specialize actually in trigger point therapy, and I deactivate or release trigger points that cause pelvic pain, but also affect the nerves that supply the internal and external genitalia, as well as the urethra and the bladder and the anal area. And it's also, acupuncture is really good for treating scar tissue. So for people that are post-op, it helps to reduce numbness in the scar tissue, or a lot of times there could be hypersensitivity. If there is an abnormal pull in the muscles or the fascia created by the scar tissue, it will help with that as well. And also a lot of times, if a scar is sitting on top of an organ, so for example, if there's a scar over a bladder, it can actually irritate that organ and create symptoms in that organ. So a scar over a bladder can actually create urinary urgency. So by treating that scar, you can eliminate that symptom.
So what are some of the most common questions that patients come in with?
So I guess the first question that usually comes from my pelvic floor patients is where do the needles go? The needles never go into the genital area, but rather they're placed into the muscles or the nerves that supply the genital area. And then also a lot of people are, there's a fear of needles. They're concerned, if it's going to be painful. And it's actually, it's not a painful procedure at all. It's very comfortable. Most people feel relaxed after. And a lot of people do fall asleep on the table.
Tell us how you became specialized in pelvic floor dysfunction as an acupuncturist.
So I actually had a family member that was suffering from a pelvic floor condition, and this was a few years ago. And he went to a doctor, and the doctor said that there was nothing could be done about it. And to me that almost sounded like a challenge. And also at the time, that was not a very well-known field. There wasn't a lot of there weren't many doctors specializing in it. There wasn't a lot of information available about it. And just, I wanted to help. And because it was so unknown, I became more interested in it. I became more curious about it. And I feel like to be really good at treating pelvic floor symptoms, you really have to be passionate about it, and you really have to educate yourself on the subject. Once you see how grateful people are, once you're able to help them, that is even more, motivating to to go deeper into the field and, do more work within it.
Definitely. And I know you mentioned that you work directly with a physical therapist in your practice. Are there other practitioners that you work closely with?
I also work with physicians and massage therapists.
So can you tell me a little bit about, as an Eastern medicine practice, how you're able to work with Western doctors and integrate together?
So for us to be able to integrate, and I think this applies to my profession in general, we really have to be careful about the language that we use, that we speak to other medical practitioners, and it has to be the language that everybody can understand. And when this medicine was designed thousands and thousands of years ago, they used the language that they knew at the time. So, if we describe something, a condition, and it has excess heat, in this day and age, you can just say that it means inflammation, because that's exactly what they meant, thousands of years ago. But once again, they used the language that they knew at that specific time. And, once we're all speaking the same language, then we're able to work together. And I think a lot of Western practitioners now, and medical doctors specifically, they recognize the benefit of acupuncture. They have become more open to it, and that's because there's also a lot of studies. There are scientific studies that are being done that are helping to explain acupuncture and the mechanism behind it. And because of that knowledge that we're getting now, I think we're more able to integrate into Western medicine.
That's really exciting. So what are some reoccurring things that you see that can be addressed preventatively?
So from my observation, in my own practice, I noticed that a lot of my pelvic floor patients suffer from anxiety. And in some cases, you can almost hypothesize that the anxiety and the high stress is actually what caused their symptoms in the first place. And it's very interesting to me that when we're little, we're actually taught how to brush our teeth, or we're taught that we have to shower every day. So we just they teach us how to take care of our physical body, but nobody really teaches you how to how to deal with stress, or how to take care of your emotional well-being. And then when we grow up and we're exposed to a lot of stress, or we're dealing with emotions of anxiety or depression, we don't really know what to do about it. And things such as meditation and breathing is something it has actually been scientifically proven to be really effective in cases of high stress and anxiety. And even Harvard spent so much time and money researching meditation, and it's been proven that it's one of the best things out there. And I really wish that, this is something that would be taught to people when we're little, so that when we grow up, it becomes, it's ingrained in us, and it's part of our daily routine. So as an adult, just like you would not skip on brushing teeth, you would not skip on doing a meditation session. And if it's done consistently, it can have really, really incredible benefits for dealing with anxiety. Also breathing exercises, and that helps to calm the nervous system down, and that helps with stress and anxiety as well. I would say for people that have desk jobs that do a lot of sitting, also sitting with bad posture, so that can really mechanically put a lot of stress on our pelvic floor muscles. Plus, if we're exposed to a lot of stress at work, that can lead to a problem. So for those people, I would recommend swimming or yoga. And those types of activities, it's still it provides for a good workout, but it's not too strenuous, and it allows for proper circulation, and it also allows for you can stretch your abdominal muscles, your pelvic floor muscles, and so on. Because exercises that are too strenuous, if you do excessive abdominal workouts, or people that do CrossFit, that can actually weaken our pelvic floor muscles, or it can actually create a lot of tightness in the pelvic floor muscles. And it's a very well-known thing that a lot of women that do CrossFit actually suffer from incontinence. For people that suffer from constipation, as soon as you develop those symptoms, that's something that should be addressed right away, because eventually, so you're sitting in the toilet and straining, eventually that could lead to problems in the pelvic floor. Something from Chinese medicine specifically, sitting on cold surfaces can actually, they would call invasion of cold. So when the cold settles in your body internally, what it really means is, it can cause severe constriction in the blood vessels and the muscles, and that can lead to a lot of pain. And I would say also wearing really tight underwear, and that applies to women mostly, that constricts, circulation, lymph flow, and that can create problems in the pelvic floor as well.
Wow, thank you. Super informative. Can you tell us some patient success stories from your practice?
I actually had a female patient last week who came with a lot of pain in her pelvic floor specifically, but then she was feeling a lot of pain and a lot of burning with urination, and then she was also having a lot of hip problems. And after talking to her and just examining her pelvic floor, I realized that she does a lot of yoga, which is great, and yoga is really helpful for pelvic floor muscles, but she always has a habit of really sucking in her stomach and just really holding in her abdominal muscles. And I felt that, after I palpated her pelvic floor muscles, I just felt that there was a lot of tightness in the abdominal muscles and the psoas muscle. And it was obvious when I was actually pressing in all the different spots on the abdomen, some of her symptoms could be reproduced. I treated it. We did a front treatment, we did a back treatment, and then a few days later she emailed me and told me that her symptoms were gone.
Wow, that's amazing. Do you have a message of hope you can share with people out there who are suffering right now from anxiety, pelvic floor dysfunction, a number of these conditions we've mentioned?
So I would just say, don't be afraid to reach out for help. And also don't be embarrassed by your symptoms. Don't assume that it's just you that is suffering from those symptoms. There are a lot of practitioners now, there are a lot of doctors that are interested in the field that really truly want to help. There are a lot of people that specialize in it. So, there are a lot of support groups that are out there. So really, don't be afraid to reach out. And pelvic floor symptoms are definitely treatable now.
Can you tell us how you talk to your patients about the complexities of pelvic pain?
So a lot of the times when people first come in, they're mostly just focused on their physical symptoms. And in a lot of cases, you have to explain to them that, a pelvic condition is actually, in a lot of cases, it's more than that. It's, you have to look at the environment, you have to explain the mind and body connection. If they're suffering from depression or anxiety, or if, they're under a lot of stress, that can definitely contribute to their symptoms. And once you explain to the patient that there is a lot more going on, and for them to get better, they would actually have to, participate in that as well. Usually, they're grateful for the fact that, now they know that it's a lot of layers to their problem. And usually it's the, behavioral aspect, it's the different relationships that people have outside, at work, at home, and so on. It's their mental health, it's the diet, it's everything else that's out there that must be corrected for them to get better. And usually a lot of them do appreciate, that you don't just focus on the physical symptoms, but you look at the whole picture. And once they're more aware of it, they become more willing to participate in their health. And actually what really fascinates me is when I was looking at different treatment approaches for the pelvic symptoms, and I was looking at different acupuncture points and so on. And there's actually one specific point that is located under the tailbone. And when you look at the different indications for that point, it, in addition to all the physical symptoms, it actually tells you that that's the point that you would use for anxiety and depression and even epilepsy. So it's so fascinating to me that, even, like thousands and thousands years ago, when they were treating the pelvic floor conditions, they actually recognized that in a lot of cases it wasn't just the physical, but it was, it was the other aspects of life that were, really involved and needed to be addressed in order for the people to get better.
Definitely. So can you tell us where people can find you?
Yeah, so my practice is located in Midtown. I am on 39th between 5th and Madison, and my website is milamintzisacupuncture.com.
Awesome, thank you so much. I'll link all of Mila's information in the group. Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.